everyone, this is Dr. J back again with the Human Movement Institute, where we have improvement through movement. Today we will be discussing a home exercise program to prevent hallux, valgus, and or bunions. So we can title this video Anti-Bunion, Bunion Reversal, and or Anti-Hallux Valgus. First is to start with manual toe spreaders. This helps stretch some of the tight structures on the base of the inner toe. However, stretching or spacers or bracing is not enough. That's one part of the treatment. The second part of the treatment is to strengthen the musculature, particularly abductor hallucis, which is the number one foot intrinsic muscle that stabilizes the medial longitudinal arch. It's also what abducts or spreads the toe. Many patients will have atrophy of abductor hallucis. So I might spend a minute or so spreading my toes, working my fingers between my toes, working them down, working them up. We're loosening what's tight to better activate what's weak. Next is the towel toe curl exercise. This is an exercise that helps us engage both foot extrinsic and intrinsic. A couple key features is the toes spread, push down, then curl, then extend and open. So I'm spreading, I'm pushing down without curling, then I'm curling, and then letting go. 1 to 2 minutes of this would be a good starting dosage to wake up extrinsic and intrinsic foot muscles. Next is disassociation of big toe to second to fifth toe. Can I push the second to fifth toes down as I lift my big toe up, and vice versa? Can I push the big toe down with the second to fifth toe up? So this helps you disassociate big toe, or great toe, as we like to call it, versus second to fifth toe. Next is strengthening of the long toe flexor in an aligned position. So I'm using the TheraBand to take the hallux valgus away to align the toe, and then I'm practicing big toe curls. 3 sets of 10 to 15 reps is a good initial dosage. Over time, you could do more reps and or use more resistance. Next is to do extensor with alignment. So I'm using TheraBand to align the big toe. So I'm taking it out of hallux valgus to a neutral toe position with the TheraBand, and then I'm strengthening extensor hallucis longus and brevis. The other beautiful thing here is we're allowing the abductor hallucis to contract as we do these exercises. Good starting dose, 3 sets of 10 to 15 repetitions. Last is with any balance activities like single leg stance, can I sense that my arch drops versus lifts or is neutral? Here I have a neutral arch, subtalar joint neutral with great toe neutral. Now I have more surface area to practice balance activities. When we walk and I load the heel and go into mid stance, we should have a neutral foot where the foot core is stabilizing the arch. However, most people's big toe comes over and arch drops and the sesamoids rotate around. So this can be practiced anytime, anywhere. It can also be practiced with squatting and or other exercises. Cool down should be a gastroc stretch. Knee straight, toes spread, Hold for 30 seconds to 1 minute, 2 to 3 times. Static stretching is best done at the end of activity. You can be dynamic to restore ankle dorsiflexion. So I personally like to do 10 ankle dorsiflexion, then go back to 30 seconds to minute stretch, and then 10 more after the minute, and relax. If you've liked our anti-hallux valgus video, please hit the like button, the subscribe button, and please share it with your friends and family. Take care and see you again soon.